Since its formation, the Peace and Hope Trust has strived to reach those not served by others. In Nicaragua, large numbers of people, particularly in the more remote rural communities, struggle to gain access to even basic medical and dental care. For a number of years now, volunteer dentists and doctors have joined the Trust's teams to reach out to some of the most isolated peoples and bring modern medicine, dental care and education to those who need it most. In January 2014, a team of doctors and dentists from the UK joined the Trust to continue this work. Starting at the regional hospital in Bluefields, while the doctors discussed with the hospital staff the wider needs of the Bluefields region, the dental team set up shop in the hospital's rather dilapidated dental surgery. The team worked alongside resident dentist Jose Manuel to bring relief to some of the local population. A dental surgery in the UK, which is due for refurbishment, has donated the entire contents of its current surgery to the Trust. This will be shipped out in the Trust's container and installed in Bluefields Hospital.
The setup in the dental surgery in the hospital is so totally different to what we have at home. I mean, it appears to us incredibly run down, and it is important, I think, to know that the quality of the clinical staff is so much more superior than the quality of the equipment and the accommodation that they have to work in. They're really kind of very talented and decent clinicians.
Dental care at Bluefields Hospital is free, but for those living further afield there is little or no provision. Travelling to Bluefields is difficult and expensive for local people, so the team set out to bring primary care to some of the more isolated communities in the region.
This was donated by the Rotary Club of the Wye Valley, who are a Rotary Club in Hereford.
The island community of Rama Key was thrilled to receive the team, and people queued all day to have teeth pulled or have a consultation with the doctor.
Both children basically got coughs, and Wendy's just checking the second one over at the moment. Certainly the first one's absolutely fine, just a little bit of reassurance. We're not quite sure what's up with Granny, but we're going to find that out in the next 5 minutes.
That's good. Sometimes aspirin irritates the stomach and it makes you anemic. I wonder whether she needs a little bit of iron in that case. Of the 17 people we've seen, 2 of them have definitely been poorly. 2 children who are quite sick, who needed some treatment. And 1 was an elderly gentleman who probably, certainly at home, would have had some more tests to find out what's going on.
And at home, with the elderly gentleman, it's the easiest thing in the world to run off a couple of blood tests, maybe a simple ultrasound scan, and straight away within a few days you've got a result. Is there something wrong with this guy? Do we need to investigate this? Or is he okay? And we can say, look, you're all right, nothing wrong. And here, it's really difficult to do that, isn't it?
Yeah, it's very difficult.
All right. It's actually amazing what you can get out. They can be incredibly broken down, the teeth, and you amazingly can just kind of wiggle the roots out if you're patient and keep going. And you take them out in perhaps a completely different way to how you would do at home as well. But it works. I think we're their only chance of getting rid of a load of these really nasty, chronically infected, painful and smelly, disgusting teeth.
In addition to surgeries and consultations, such visits provide an excellent opportunity for education and for the distribution of toothbrushes and toothpaste to help reduce the amount of decay in the first place.
Red one.
At the end of the day, one patient who required urgent surgery was brought back in the team boat to receive treatment at Bluefields Hospital. The more remote communities will travel far to reach the travelling dental surgery, but even though the facilities may be even more basic, the need is even greater. By the end of the team's visit, a huge number of people had had their pain relieved, urgent medical needs had been identified and referred to hospital, and the team has gained a greater understanding of the priorities for care in the region. As a result, with your continuing support, the Trust can focus its efforts more on finding the right medicines and the most valuable equipment, and delivering them to where they're needed most.
That's good.